Amiodarone is a very effective Class 3 antiarrhythmic agent that is commonly used for serious ventricular arrhythmias and for many atrial arrhythmias, including atrial fibrillation and flutter. It has also been suggested for prophylactic use in cardiovascular surgery patients who have temporary atrial fibrillation in the acute postoperative stage of recovery. Amiodarone is widely used intravenously, and this relatively short time use of the drug has been very effective. However, chronic oral amiodarone use can have many unwanted side effects, usually related to higher doses and prolonged therapy. Adverse reactions to amiodarone, which occur in approximately 75% of patients, may be so severe that therapy must be discontinued despite a history of life-threatening arrhythmias. One of the most important adverse reactions to the medication is pulmonary toxicity, which involves a clinical syndrome of progressive dyspnea and cough secondary to pulmonary fibrosis. While these lung problems are gradual in onset, they are not easily reversible and can be fatal. Baseline and follow-up chest X-rays are usually obtained. Full pulmonary function testing with diffusion capacity is often monitored periodically. Amiodarone may gradually slow the heart rate and produce severe bradycardia. Since iodine is part of its chemical structure, the drug can cause either hypothyroidism or hyperthyroidism, and thyroid studies are usually obtained. Neuropathy with abnormal gait, numbness, and paresthesias is frequently encountered. In addition, amiodarone has an exceptionally long half-life, and therapeutic effects and side effects can last for months. Amiodarone can raise blood levels and potentiate the effects of digoxin and warfarin, so those medications must be monitored more closely if taken in conjunction with Class 3 antiarrhythmic agents. Before discharge home on a Class 3 medication, the patient should be informed of the need to use sunscreen. Because of the photosensitivity caused by these medications, sunburn may occur with very minimal exposure.
Mr. Jones, how are you doing?
I'm not doing too good. My heart's awfully racy, and I feel lightheaded.
Yeah, I saw that on the monitor. Yeah, I realized that your heartbeat has gone faster. You're in a condition, your heart has gone into a condition called atrial fibrillation. I saw that on the monitor. Yeah, let me check your blood pressure, okay? You're right, it's showing a little bit low. It's 96/40 right now. So yeah, that explains why you're feeling lightheaded. Let me go and call the doctor and see what medication he prescribes. Atrial fibrillation, is nothing really to worry about right now. And I'll see what medication he prescribes so we can bring your heart rate down.
Examples of Class 4 antiarrhythmic agents are calcium channel blockers that possess antiarrhythmic properties, such as verapamil and diltiazem. They are indicated for the treatment of some paroxysmal supraventricular tachycardias. They may also be effective in controlling the ventricular response in atrial fibrillation and atrial flutter by slowing conduction at the AV node level. Both medications are available orally and parenterally. Calcium channel blockers should be administered with caution to patients who are hypotensive, have heart failure, have severely reduced left ventricular function, or have a second or third degree AV block.